A tooth infection is not something the body can easily ignore. What may begin as a small toothache can quickly become intense pain, swelling, or pressure in the jaw. Many people wonder if there is a way to treat this kind of infection at home, especially when dental care is not immediately available. The short answer is complicated. Some things can be done at home to manage symptoms temporarily. But a true tooth infection is not something that home remedies can completely cure. Understanding what you can safely do at home and when professional dental care becomes necessary can make a major difference in how you handle the situation. A tooth infection, often called a dental abscess, usually begins when bacteria enter the inner part of the tooth. This can happen through deep cavities, cracks in the tooth, or untreated gum disease. Inside the tooth is soft tissue called the pulp. When bacteria reach this area, the body reacts with inflammation and infection. Pressure builds inside the tooth and surrounding tissues, which is why tooth infections often cause throbbing pain. Over time, the infection may spread into nearby gum tissue or even deeper into the jaw. This is why tooth infections are not just about discomfort. They involve bacteria multiplying in an area where the body has limited ability to clear the infection on its own. Many people first notice a dull toothache that slowly becomes sharper or more persistent. The pain may worsen when chewing, drinking hot or cold liquids, or lying down. As the infection progresses, other symptoms may appear. These can include swelling in the gums, sensitivity to pressure, bad taste in the mouth, or swelling in the face or jaw. At this stage, people often search for ways to treat the infection themselves. There are a few things that can help manage symptoms temporarily. One of the simplest steps is keeping the area as clean as possible. Gentle brushing and careful flossing can remove food particles and bacteria around the affected tooth. Rinsing with warm salt water is another common method people use. Salt water can help reduce bacteria in the mouth and may provide mild relief for irritated gum tissue. While this does not eliminate the infection deep inside the tooth, it may help reduce surface irritation and keep the surrounding area cleaner. Another step that can help with discomfort is managing inflammation and pain. Some people use over-the-counter pain relievers according to recommended instructions. These medications do not treat the infection itself, but they can help reduce pain and inflammation while waiting for dental care. Cold compresses applied to the outside of the cheek may also help reduce swelling and numb pain temporarily. Hydration and avoiding extremely hot, cold, or sugary foods can also prevent additional irritation to the tooth. However, it's important to understand the limits of these methods. None of these home strategies remove the bacteria trapped inside the tooth. Once infection reaches the inner pulp of the tooth, the body cannot easily clear it on its own. The structure of the tooth prevents immune cells from reaching the infected area effectively. This is why dental treatment is usually required. A dentist may need to perform procedures such as draining the abscess, removing infected tissue through a root canal, or in some cases removing the tooth entirely. Without proper treatment, the infection may continue spreading. Another important issue is that symptoms may temporarily improve even while the infection remains. For example, if an abscess drains on its own, pressure inside the tooth may decrease. Pain might fade for a short time, giving the impression that the infection has resolved, but in many cases, the bacteria are still present and the infection can return or worsen later. This is why temporary relief should not be confused with actual healing. There are also certain warning signs that suggest a tooth infection may be becoming more serious: significant swelling in the face or jaw, difficulty opening the mouth, fever, or trouble swallowing can indicate that the infection is spreading beyond the tooth. In rare cases, untreated dental infections can spread into surrounding tissues of the face or neck. When symptoms like these appear, prompt medical or dental evaluation becomes very important. Another factor people often overlook is prevention. Many tooth infections begin with problems that develop slowly over time. Cavities, gum disease, and small cracks in teeth can allow bacteria to enter deeper layers of the tooth. Regular dental care, proper brushing, flossing, and routine checkups can often prevent these issues from reaching the stage of infection. When early problems are addressed, the chances of developing a painful abscess decrease significantly. But even with good dental habits, infections can sometimes occur. When they do, understanding what home care can and cannot accomplish helps people respond more responsibly. The key insight is that home care for a tooth infection is mainly about symptom management, not complete treatment. Cleaning the mouth, rinsing with salt water, managing pain, and avoiding further irritation may help control discomfort temporarily. But these steps do not remove the underlying infection inside the tooth. Professional dental treatment is usually required to fully resolve the problem. Knowing this difference can help prevent people from delaying care for too long. Tooth infections can be extremely uncomfortable, and they can also become serious if ignored, but understanding the basic structure of the problem makes the situation clearer. Home care can support comfort and hygiene while you arrange proper treatment, but it cannot replace the procedures needed to eliminate the infection itself. Recognizing this boundary helps people make better decisions about their health. If you found this explanation helpful and want to learn more about handling common health problems safely at home, consider subscribing to the channel. And if you'd like to explore a detailed guide that explains many practical medical situations people may face, including how to manage symptoms and recognize when professional care is necessary, you'll find a useful resource linked in the description that walks through these topics step by step.